And the thought experiment is this, if you had a choice between having the best hospitals and the best treatment in the world, which is really the medical care approach, or if you had the choice to get up every morning and turn on your tap and have clean water and then go to your kitchen table and have nutritious, sanitary food, and then walk outside and you can breathe clean air, get in your car and you wear a seatbelt, or where there's tobacco and alcohol control. Which of these two worlds would you want? Would you want to be able to see the best doctors, or would you want to live your life, free of the major risks that we all face, including, for example, walking outside and being bitten by a malaria infected mosquito or Zika? And then when I do that, almost every audience from New York to Delhi to London, Paris, and Beijing, every single audience almost unanimously chooses the public health approach. That is, they'd want to live in a world where it was healthy, but yet all of our global assistance goes to medical treatment, and very little goes to what it takes to make a human being happy and healthy. And most of us want to live in a place that's really kind of nice to live in. I know when I go to Delhi, for example, and I breathe the air and it's so polluted, and you go to the markets and there are, flies buzzing all around all of the fruits and vegetables and meats. And there, and there's, risks of, waterborne disease, mosquito-borne disease, and a whole range of other things. And I come back and, you just don't feel well. I never feel well. But if you go to a place like, say, Sydney, Australia, or to Stockholm or to Berkeley, you feel good. You feel happy because the sun's shining, you can breathe the air, the food's safe and healthy, the water is safe and healthy. You don't have to worry about mosquitoes and vectors and rats and things like that. It's a much better way to live. And everybody should have the right to live in that kind of environment.